Okay, so this is extension bias exercises, which is most of the time if you have an acute back situation, perhaps a pinched nerve or bulging disc, 9 times out of 10, extension exercises are going to be preferred to flexion-based exercises because of where the nerve typically gets pinched or where the disc bulges. So I'm going to go down onto my stomach. So I'm biasing extension of my lumbar spine here. I do not want to go totally crazy and go all the way up here. I'm going to keep my forearms down on the surface that I'm lying on. Generally a firm surface works best. However, you may have difficulty getting down on the ground and back up. So if your bed is all you can manage, then just do it on that. So I'm going to put my hands flat like this. So it's kind of, those of you familiar with yoga, this is kind of similar to a cobra position. I'm going to make sure to keep my shoulder blades back best I can, but that's not really the focus here. It's going to be my low back and my pelvis and my sacrum. So what I want to do here is I'm going to start off by just gently lifting through my chest. I may not want to crane my neck too much here, depending on if you have any neck issues. The focus is thoracic spine and your hips, and then the lumbar spine in a controlled fashion in between the two. So if you can, keep your core a little bit engaged as you kind of flow through this. So as I get comfortable with this, I can start to do a little rotation, like I'm looking over my shoulder with that extension. Pay attention if one side feels tighter, not necessarily painful. I mean, painful you want to be aware of, but if it feels like a stretch going one way, you probably need to stretch that way. Just make sure it's not too painful. And then finally we can do either just like a shifting side bend, or you can actually work your arms over to one side. Again, not painful, or the other. And you can even kind of combine them all, something like this. But again, not too extreme, especially when you're first starting out with these. And those are the ones you're gonna wanna focus on for that. The other thing to keep in mind is core engagement. So you can start off simple with that. You know, simple pelvic tilt, but again, don't be excessive. Don't like force it down. Think about just rolling that back gently, using your glutes and your abdominal muscles to lift in the front. You can progress that to seated or standing, and we're gonna come around the wall for this one, or just the door. So a lot of times what I've seen is that doing this is a little bit too much because of lack of control. So what you can actually do, and don't do this on a door that opens away from you like I'm doing, but put your hips back, your butt up against the door, and you can actually stabilize much better through your hips and your heels here. And you can even use your upper body or your hands if need be, but this is usually more comfortable. And then if you're free enough, you can put your hands here and try to do a little lift here, or a pelvic tilt like this, which is similar to lying down, but much more functional. And then you can progress to facing the surface and trying to get it here as you keep your chest up and forward and hips back, and try to get that pelvic tilt very gently. But you want to draw in, lift up from the abdominal as you ground down to the hips and glutes to really stabilize and protect your back. Good.